Doctors, what's something someone came to the hospital for that they thought wasn't a big deal, but turned out to be much worse? Story 1. Of course, not a doctor myself, but this is what happened to me. About 4 years ago, I was at work and was just feeling crappy. Chest pain, shortness of breath, shaky, and chills. Thought it was a flu with heartburn or something. I ended up finishing work that day and having my mom pick me up and take me to our local hospital. Since I just thought I would go to the ER, get some meds, and go home, I didn't even think to go to the ER at the state-of-the-art urban university hospital that I work at. I was 27. I didn't think it could be anything serious. Got to the hospital, was admitted right away to the ICU where I spent 4 days. Turns out that a mysterious virus had attacked my heart, causing pericarditis, or a buildup of fluid in the heart. They tested my blood for everything they could think of, but they still have not been able to figure out what it was. Was put on meds, released, and out of work for 2 months. Fast forward 2 months, and I can't lay down without coughing. Go in for chest x-rays. Turns out I am now in full heart failure because the virus damaged my mitral valve so much that it now needs to be replaced. I had open heart surgery a few months after that, all because of some mystery virus that didn't even get named after me. Story 2. My son was 7 months old and had a fever that wouldn't go down. I've tried Tylenol, a cool bath, and it kept rising. He was my third baby, so I wasn't terribly concerned, but we were leaving the next day for a weekend at a remote cabin, and I thought I should get him checked out and get some antibiotics for him. I called the clinic just as it was about to close. They stayed open for me, and when I walked into the empty waiting room, he vomited all over me. The doctor looked in his throat and in his ears, then turned to me and said, "With your permission, I would like to do a spinal tap." They ushered me out of the room, then called me back in a few minutes. The doctor showed me a vial of fluid and told me that because it was cloudy, that he had spinal meningitis. She asked me if I was okay, then told me very calmly to put the vial in my purse, take my baby, drive directly to the hospital, go into the emergency entrance, walk directly to the elevator, go up to pediatrics. People would be waiting for me. I did as I was told. When the elevator doors opened, there were about 5 people waiting for me. They took my baby from me and hurried away. The next time I saw him, he had tubes and sensors all over his body. It was a scary night, but he made it. I knew he was going to be all right the next morning because while I was nursing him, someone came in the room, and when the door closed, he did that baby startle thing, hands in the air. With meningitis, the hearing is the first thing to go. 10 days in the hospital, but full recovery. The clinic receptionist that kept the clinic open for me later told me that she just had a funny feeling when I called. I can't even imagine the panic you would feel as a parent getting told to take your child to the hospital like that. I'm so glad everything turned out all right. My God, I have no kids, but I am still, anxious just having read what you went through. Story 3. We had a guy who showed up to the ED with a bad cough. His wife kept saying that she had tuberculosis 20 years ago, and although she was treated at that time, she was convinced he had it. His symptoms were far more consistent with pneumonia, and he lacked classic TB symptoms. We got an x-ray, and sure enough, it was TB. Now I have to do several blood tests over the next few months to ensure I don't have TB. Sometimes the patient is right. Another time I saw a lady in the ED with a chief complaint of headache. She basically provided no history and just kept repeating that her head hurt. I tried to get some background, past medical history, etc., but she wouldn't say anything other than, "My head hurts, give me something for the pain." On her chart, she had tons of previous visits for vague complaints and requests for narcotics, which all resulted in basically nothing, so I initially thought maybe she was drug-seeking, but her behavior just seemed odd. We decided to scan her head and left to go see other patients. I came back a few minutes later, and her husband was there now. I asked what happened, and he said she was just standing in the kitchen cooking when all of a sudden she dropped to her knees and then immediately complained of a horrible headache. While I was talking to him, she began vomiting all over herself. We rushed her to CT, and she ended up having a subarachnoid hemorrhage bleed in her brain. She was taken straight to surgery and ended up being fine after spending about 6 weeks in the hospital. That kind of stuff is so scary to me. You just get a sudden headache, and if that woman hadn't gone in to get checked, she probably wouldn't have made it. That kind of stuff scares me, and folks, if you are able, get sudden weird stuff checked out. I know it isn't financially a good option for many, but your health is important. Story 4. Not a doctor either, but this happened to me. About 4 months after I had my son, I started to notice the vision in one of my eyes was really off, blurry, spotty, etc. I didn't really think about it much because my eye didn't hurt and wasn't itchy, and I had a new baby to take care of. Anyway, it lasted for months, and finally my mom and sister convinced me I had to go to the eye doctor for it to see what was going on. I took the baby with me because I thought he was a quick appointment. Maybe 20-30 minutes, and I'll probably leave with some eye drops or something. Honestly, one of the worst days of my life. They put me through test after test. I was there for hours. I ended up calling my mom to come get the baby. They weren't telling me anything. They scheduled an MRI for the next morning because by this time, my 11 a.m. appointment had dragged out until 5:30 p.m. and the clinic was closed. We were the only people there. Still no answers. I am freaking out. Go back the next day and get the MRI done. They sent me to the neurologist. This time, no eye doctors today. When I walk in, he has all the results from my tests the day before and the MRI I had just taken a while before. I was told I had multiple sclerosis. It was very scary. Edit. For those that have asked, I'm doing pretty well. Still in the first stage of relapsing, remitting MS. I've stayed hardcore on my therapy and my family is extremely supportive, which makes a huge difference. The first years were the hardest with a toddler and learning to adjust. Now he's 10 and more self-sufficient. We decided not to have any more children, which was really hard, but overall the best decision for our family. Story 5. A pharmacy student. One of our first real patient encounters was within a free clinic. Lady gets there and after going through the routine questions, complains of an itchy foot. Okay, we'll look into that. We were being graded on this by our professors who were sitting in with us. But we had to keep on task, aka make sure you go in a specific order. So I'm going through this lady's meds, all is well according to her, takes all meds on time, though she doesn't exactly remember the names of them. A large part of the assignment was to teach us how innocently ignorant some patients are. She's getting her refills on time, seems to check out. I see you haven't refilled your diabetic monitor strips in a while. Are you in need of those? Oh, I haven't used that in a few months. It broke. Oh, well, it's important that you start using that, skipping some irrelevant talking. Okay, so let's check that foot out. Horrible hygiene and signs of developing necrosis, but caught in time. The sweet old lady had no idea her diabetes could cause such a problem. Story 6. I was working as a doctor's scribe years ago at the time in an ER and saw an old friend of mine on the patient list with a diagnosis of cough for 2 weeks. He finally came to the hospital because he had a cough the last day with a small amount of blood and decided to have it checked out. The ER doctor who checked him was the one I was scribing for, so I was in the room and went through his labs and such. We got his chest x-ray, wasn't good, and CT confirmed it, lung cancer. What's terrible is that he never smoked, didn't drink, and took care of his body. He was a very quiet, calm, and nice guy. He was then admitted and started treatment, which did not go well. He then went to Florida to try some experimental treatment a few months later. I remember sending him a Facebook message seeing how he was doing, and he said that he felt weak and sick, but also mentioned he was starting to feel slightly better. This was the last message I received from him as he passed away 1 week later. Cancer is a hell of a scary thing, and even if you do everything right health-wise, nothing is guaranteed in this life of ours. I'm sorry you lost a friend like that, and anyone battling cancer or with a loved one doing the battling, my heart goes out to you. That is a scary, uncertain time for a lot of folks, but advances are being made all the time. Treatments for a lot is really effective, so please don't lose hope. I'm pulling for you. Story 7. About 3 months ago, I had something peculiar happen to me. I was at school in the morning and got up to throw my breakfast away. When I got up, I got a severe pain around my belly button. I thought I just had a bad cramp or had to crap, so I just tried to walk it off and stretch out. It didn't go away like a cramp usually would. Oh, whatever I have a test, I'll go crap when it's done. So I took my test, took a crap, and still had pain. Well, might as well go to the nurse. I went to the hospital and the surgeon said I needed my appendix out. When they started to do surgery on me, they usually would start by making an incision under your belly button. For some reason, they couldn't do it, so they made 3 other incisions on my left side and found out my umbilical cord was still attached to my intestines. Not only that, but my intestines were free-floating, not attached like a normal person. They patched me up and told me I'll need more surgery soon for my intestines, and they took off my umbilical cord. Still got a 96 on the test. Too long didn't read. I was more attached to my mom than I thought. Story 8. My dad went into the hospital with some chest pain thinking it might be a heart attack. They kept him overnight, positive it was nothing wrong with his heart. Not a heart attack for sure, though. The next morning, they gave him a stress test, and an hour later, he was helicoptered to a heart specialty hospital for a 10-hour open heart procedure. My dad had a bicuspid valve instead of a tricuspid in his heart. It had caused an aortic dissection where the inner lining of the aorta tears and blood starts pooling between the layers. If he had gone much longer, he would have died. But he is fine now. Very lucky in this case. Story 9. I'm an ER nurse. I cared for a patient that came in because she woke up with a severe headache and a knot on her head. She went to CT for a head scan and had 2 bullets in her head. One had gone in at the top of her head, just past her hairline, and traveled under the skin, but on top of her skull to the back of her head. The other went straight in, but just fractured the skull behind her ear. It didn't go all the way through the skull. They were smaller caliber bullets. Apparently, she went to sleep the night before after taking an Ambien, and there was a drive-by shooting on her street. The bullets went through her window, and she slept right through it. Okay, we've heard a few tales of some medical rarities and strangeness, but this one takes the cake. Can you imagine essentially being shot and sleeping through it? I can't imagine just how lucky that woman is, and I'm so glad she was all right. But damn, if I was her, I would never stop telling people, yeah, I've been shot in the head. Twice. Then again, I feel like a lot of people I know would be pretty quick to reply, that explains a lot. Story 10. When I was doing my hospital placements, a patient came in laughing and skipping for their scan. They thought 100% they were in remission and clear of cancer growth. I was spending a day with the scan techs and sat in. The scan didn't show one tumor, it showed hundreds. The guy was riddled with metastases. It was terminal. He had months. He was laughing and smiling with us. He asked if we could tell him how it went, and the tech said we couldn't. It was for the doctor. The old man winked at us and walked out. He was so happy. It was one of those days that told me I couldn't do that job. Edit. I've had quite a few people ask what I do now, how I got into it. I edit a medical journal. I might do an AMA or something. Story 11. My dad went into the hospital in some pain back when he used to powerlift. A nurse comes into the room, looks down at her chart, looks back up and says, "Mr. Pickle, you are having a heart attack." He got up on the bed and flexed, saying, "Does this look like a man that's having a heart attack?" She looked back down at her chart, up again, and said, "Yes." Edit. He lived through this for those asking. He has since passed, but not from anything heart-related. Following the heart attack, he stopped with the powerlifting and got way more laid back. He started running more than lifting and learned to appreciate food a lot more. This was his favorite story to tell. I'm glad you guys could appreciate it. There are certain people who seem to think that the fact they work out all the time and are muscular means they're damned near immortal and use that as an excuse not to get checked out for stuff. Folks, while working out certainly helps with health, it isn't a get-out-of-illness-free card. Your body type doesn't guarantee you anything, aside from looks at the beach. Story 12. Had a guy come in complaining of a cough and difficulty swallowing. He thought he had tonsillitis and just wanted some antibiotics. I noticed his voice was incredibly hoarse, but there were no swollen tonsils, so sent him for a chest x-ray. Huge baseball-sized tumors all through his lungs. One of them was pressing on the recurrent laryngeal nerve, causing his speaking and swallowing problems. He died within a week. Story 13. Don't have much time, so I will keep this short. Patient presented with a small, less than 1-inch scratch on his right thigh and severe pain and immobility. On palpitation, there was crepitus, a cracking sound. We called in a surgeon in the hopes that we could excise the closed wound, but as soon as the surgeon cut the skin, the leg deflated. Yes, deflated. The escaped air was horribly putrid in odor. We ordered an x-ray and discovered the leg was simply skin and bones without any signs of muscle. I regretfully informed the patient that we had a strong suspicion of a flesh-eating bacteria called Clostridium perfringens and that the infection has spread fast. He called his family and loved ones, got a lawyer, and said his goodbyes. 12 hours after admission, he was declared dead. Please leave your story in the comments. I would love to make a video on them in the future. Also, don't forget to like and subscribe.